Hi there, thanks so much for your interest in Spruce Health. My name is Christian, and in this video, I'll explain to you why thousands of medical practices and healthcare teams are choosing Spruce for their all-in-one HIPAA-compliant and secure communications platform. To start off, I'd like to give a quick overview of all the services we offer and how those services can help benefit your practice. First of all, we do offer a unified inbox, which means all of the phone calls, the text messages, the e-faxes that you receive, voicemails, and even secure team messaging, along with telehealth video calls, are all consolidated within one inbox. That means your team will not have to use multiple different apps and systems to communicate with your patients or other medical organizations you work with. You can now do all of those things within the Spruce app. And that will help your team become more efficient at handling communications for your practice. On top of helping you become more efficient with your communications, whether you're a solo practitioner or if you have a team, we also can help you improve your patient satisfaction. With Spruce, you can now offer SMS HIPAA-compliant texting. So a patient can text the phone number and you would receive that text within the Spruce app. Now, what that allows you to do is that you can now lower call volumes and make it more convenient for your patients to communicate with your practice. And we hear this all the time. Most practices we work with are experiencing high call volumes between 12 to 2. That's when patients are probably at lunch at their work, and that's when the time they can really call you. But if you're receiving a lot of calls during that time, then it may be hard for you to get to or answer every call for all the patients that are calling in. And on the patient's end, that's not very convenient because one, they'll be on hold for a long time, or they have to leave a voicemail and wait for you to respond. Instead, they can just text the number when it's convenient for them, and your team can text back whenever it's convenient for you. Now, on top of SMS texting, we also have secure file sharing. So your patients can download the free app, or they can create an account from their computer and create a patient account, which is free for them. And from there, they can share files like photos of their ID cards or insurance cards. They can share videos, or they can even send you files through the Spruce app. We also offer group patient messaging. So if you work with older adults and you want to have a group message with your patient and also their caretaker, you can do that with Spruce now. If you offer 24/7 care where a patient can call or text you after hours, we do offer an after hours solution where a patient can call you and you can decide whether a call will ring your phone or if it will prompt them to leave a voicemail, and you can have access to those voicemail or even messages to your practice from the Spruce app on your phone. Now, with that being said, this is only for practices that are offering 24/7 care. If you're not offering that, there's ways for us to let your patients know that they would need to communicate with your team during business hours. Now, besides the phone calls and text messaging, we also offer telehealth video calls. So if you'd like to conduct a video call with your patient, you can do that from the phone app or the computer version of Spruce as well. With all that being said, Spruce is built for healthcare. And in a little bit, I'll show you examples of tools and workflows we've built with your healthcare processes in mind. Before I show you the Spruce app and how it all works, I would like to start off by explaining our phone system a little bit more. So we provide a full functioning phone system where you can purchase desk phones from us, or you could also have calls be routed to your cell phone, so you can pick up calls from your personal cell phone without exposing your number to the patient. And now when they call your number, they could also have options. It could say, "Thanks for calling our practice. If you need to schedule an appointment, please press 1. If you have any billing questions, press 2. To speak to our front desk, press 3. Or you can have it set up where it can even be options based on their clinician. So press 1 for Dr. Stein, press 2 for Dr. Steele, press 3 for Dr. Steyer here. Okay. Now, based on what the patient presses, you can decide if the call is going to ring a desk phone, is that going to ring a cell phone, or is it going to ring a group of people and the first to pick up takes the call. Or you can have the call go straight to voicemail, and if you want, you could also give an automated text back to the patient. Automated text back is actually really helpful. So in case you missed the call, it sends a text message to the patient, and it could say, "Hi, thanks for your message. We received your message, and we'll get back to you shortly. In the meantime, please text us here for what you need." And basically, that now opens up SMS texting with your patient. And in case it's a new patient, for example, and you want to win that business, now you can have an automated text back that says, "Hi, we received your message. We'll get back to you shortly. In the meantime, you can text us here for anything you need." So there's a lot of options here, and it's all very customizable to your liking. And all of these options will help you be more efficient with handling information. Based on what the patient presses when they call your business phone number, you can now decide where that message will populate. So here what I'm showing you is the filters or folders within the Spruce platform. For example, here we have the general inbox where all communication funnels into. But you can also set up filters based on whether it's the clinicians, which clinician the patient is calling for, what inquiry the patients are calling for. So let's say on the phone tree, they press, it says, "Thanks for calling, press 1 for new patients." And if they leave a voicemail or if you miss the call, we can send that message into this filter. So now your team can handle all of the incoming communications for new patients. So if you want to prioritize, winning the new business from calling these people back or texting these patients right back, you can now prioritize those messages. As you notice here, we even have one for appointments or for admin team, and some teams even have one for medication refills. So for things that are time sensitive, and if you want to, handle those calls right away or those incoming messages right away, you can now prioritize it by having a view of the different, inquiries or the different patients for each of these clinicians. Now, I'd like to show you what it looks like when a patient calls you, leaves you a voicemail, and they text the phone number. So here we see Abby, one of our patients, and notice under Abby's name there are some identifiers of what we call tags. So here we can see that Abby's insurance is Blue Cross Blue Shield. They've given us HIPAA consent to do SMS texting, and you can even put, referred by whatever medical organization referred them to you. You can also have it for their clinician. So here's Soumya. We have Jess is her clinician. And remember I told you we can have folders or filters specific to their clinician. And here Soumya's message is also within Jessica's clinician folder or filter here. Okay. But for now, I'd like to start by showing Abby's interactions with the practice here. So Abby called the number. It even tells you the date and the time here. And if you would like, you can play the voicemail here.
Testing 1 2 3. Testing 1 2 3. Very.
And from there, the voicemail is also transcribed, so you can just read it instead of having to listen to it. And automatically, because Abby left the voicemail, she received an automated text back that says, "Sorry, missed your call. We'll get back to you soon." And then afterwards, Abby texted the number. She texted back. And from there, we can also set up these automated response. So you can give them expectations of when you'll be messaging them back. So here it says, "Hi, you've reached Chris Primary Care. We typically respond in 2 hours. If you message us outside of 9 to 5, we'll get to you the next business day. Thank you for your patience. If this is an emergency, please call 911. And from there, we then texted Abby. I texted her, "Hi, Abby," right? And Abby would not know I'm messaging her from an app. It just looks like she's getting a text message from the business number. And I'm showing you this because now you'll notice the phone call logs, the voicemails, and the text messages for this particular patient is all unified in one thread. Most other systems, messages will be in one place, or the text messages would be in one place, and then the voicemail or the call log would be on the desk phone, right? And it's all completely separate. Now it's all in one place for this patient. Now on top of that, if you wanted to communicate with your team members, and let's say one of your team members received this message or this call, and they want to send it to a group or another individual, I could then say let's say, Clinician David, can you please reach out to patient? And what happens is this individual, or you could also page a group of people, right? They'll all get notified, and the first one to see the message, they can simply click here to resolve, and then they can scroll up and pretty much see all of the interactions you've had with this patient. So you don't have to tell them what's going on. They can literally scroll up and see all of your messages, and then they can even see the internal notes that your team members or maybe you have actually inputted into the system here. So here, there's an internal note of a phone call, patient needs XYZ, it's waiting for prior authorization to be approved, etc. And by the way, all of the internal notes, this is only viewable by you and your team. The patient does not see any of this. So, yeah. Next thing I'd like to discuss is the secure messaging. So I mentioned earlier, patients can download the free app, and they can send you PHI, such as their insurance cards, ID cards. They can send you files, like PDF files as well. And in here, I could also initiate a video call. On the patient's end, it would look like they're getting something similar to a FaceTime call, and their phone will start ringing, and they can answer the call and be connected with you through video. Okay, and you'll notice here the video call is logged. In this case, it was unanswered, but if it was answered, it would tell you the date and the time and how long the video call was. Okay, now if you would like to input all of this information or all of the interactions into your EHR, you can easily do that with Spruce. So here's how you do that. So you would select the message, okay? You would select all of the messages that you want. Let's say I also want to log the video call. And if you open up notes within this patient's chart, and imagine this is the note section, you can basically copy the message and paste it into the notes within the patient's chart, and it creates a timestamp of all the interactions. So here it tells you a date, the time, and then the message itself. Okay, and then for pictures or audio files like the voicemail earlier that you heard, or in this case for this picture that we received here of the patient's insurance ID, now you can open that directly from your EHR. And now you can view that message or that photo. Okay. All right. So that's the secure messaging with the patient. And by the way, all you have to do is invite them to download the free app. They'll get a link. They'll click on it, and they can even create an account from a computer as well. Another thing I mentioned earlier are faxes. So we offer an eFax capability where you'll receive faxes as a PDF that you can open up directly from your computer. So here's a fax from another organization, and then you can scroll down, you can see the fax from them. And if you need to, you can download this and upload this into your EHR, and all of that will be logged within that organization's contact. So if I click into the contact, you'll see all of the incoming faxes from this organization. Okay, so that is that. Now, the next thing I'd like to show you are team group chat. So as I mentioned earlier, you can now chat securely with either one individual on your team, or you can also have group message between your team, whether it's regarding a billing inquiry or maybe regarding a patient's information. You can now create group messages based on anything you want it to be. Okay. So with all of that being said, all of your communications is in one place. It'll make it easier for your team to communicate with patients or other medical organizations you work with. And overall, it'll help you consolidate costs as well. If you're paying for different services for all of these communication channels, now you would just need to use Spruce for all of those things. Now, the last thing I'd like to discuss is our pricing. So all of our capabilities, such as the phone calls, text messages, video call, eFax, secure patient messaging, and team messaging, it's all included in the basic plan. Okay, it's $24 per user per month. That is basically any user, could be providers or admin team members, would be considered a user. Now, if you need the phone tree or the desk phone, if you would like to purchase desk phones, you would have to be on the communicator plan for that, which is $49 per user per month. Also, if you need to use our integrations, we do have some integrations with a selected number of companies, then you would need to be on the communicator plan. It's $49 per user per month. That is the only cost. This includes taxes and fees. And the only outside cost of this is if you need to purchase desk phones. And we can send you information on that if you'd like. Feel free to message us if you would like to receive that information. Thanks so much for tuning into this video. If you have any other questions, feel free to message us in the app, or you can email us as well. And I'd also highly recommend to check out the videos that we sent you, one on the introduction to the Spruce fundamentals, and also how to set up your Spruce account so you can get started to start testing it out and trying out the Spruce capabilities. So thanks so much, and I hope you have a great rest of your day.